Is Wellbutrin a drug that could help you? Find out today by Kinley Morrison. First, let's start off with a few questions. How would you describe your mood lately? Have you been feeling depressed? Have you experienced the loss of interest in usual activities? Have you had any significant change in weight or appetite? Are you having issues falling or staying asleep? Have you noticed any decrease in energy? Have you had any feelings of guilt or worthlessness? Are you having difficulty thinking or concentrating? Have you had any thoughts about suicide? And if so, do you have a plan to carry this out? Are you a current smoker, or do you have a history of smoking? Have you had any changes or a decrease in sexual desire? Have you said or have you thought any of the following statements below? I need to quit smoking. I'm having trouble quitting smoking. Nothing has seemed to help me quit smoking. I've been feeling depressed. I do not have energy. I am having issues with sleeping and eating. I've been depressed for a very long time. I am no longer interested in activities that used to bring me joy. I am struggling in school or work because of my depression. I'm no longer interested in school or work. I do not have the energy for school or work. I cannot seem to follow through with or complete tasks at school or work. I am having problems focusing at school or work. My depression has led me to lose interest in sexual activities. I no longer have a sex drive, and it has been causing issues between my significant other and I. If you have answered yes to any of these questions, then Wellbutrin might be right for you. But first, what is Wellbutrin? It's better known as bupropion, and this drug comes in a variety of forms, but for this PowerPoint, we're going to focus on Wellbutrin. Wellbutrin can be used to treat a variety of conditions, such as the treatment of depression, which usually involves psychotherapy. It can also be used to treat depression of seasonal affective disorder, better known as SAD. And this is the mood disorder in which a person who usually has normal mental health throughout most of the year experiences depression at the same time each year, usually in the winter. It can also be used to help a patient quit smoking. Wellbutrin also has a few unlabeled uses, meaning it has been proven to help treat other symptoms it wasn't originally intended to, such as the treatment of ADHD in adults. It can also be used to increase sexual desire in women. The therapeutic classification of Wellbutrin is antidepressant and a smoking deterrent. The pharmacologic classification is aminoketones. There are 3 types of Wellbutrin, and each has specific medication administration considerations. First, we have the immediate release. It can be given 100 milligrams twice daily initially. After 3 days, it may be increased to 100 milligrams 3 times daily. After at least 4 weeks of therapy, it may be increased to up to 450 milligrams per day in divided doses, not to exceed 150 milligrams per dose. You should wait at least 6 hours between doses at the 300 milligram per day dose, or at least 4 hours between doses at the 450 milligram per day dose. There is also sustained release Wellbutrin. 150 milligrams once daily in the morning may be given. After 3 days, it may be increased up to 150 milligrams twice daily with at least 8 hours between doses. After at least 4 weeks of therapy, it may be increased to a maximum daily dose of 400 milligrams, given as 200 milligram doses twice daily. There is also extended release, and this is usually a 150 milligram tablet given once in the morning, and it may be increased after 4 days to 300 milligrams once daily. Some patients may require up to 450 milligrams daily as a single dose. Here is some additional administration information. The doses should be equally spaced time increments during the day to minimize the risk of seizures. Risk of seizures increases fourfold in doses greater than 450 milligrams per day. It may be initially administered concurrently with sedatives to minimize agitation. This is not usually required after the first week. It may be administered with food to lessen GI irritation. Insomnia may be decreased by avoiding bedtime doses. Nicotine patches, gum, inhalers, and spray may be used concurrently with Wellbutrin. Insomnia may be decreased by avoiding bedtime doses. May require treatment during the first week of therapy. Advise patient to not break, crush, or chew medications. Some common side effects include agitation, headache, dry mouth, nausea, vomiting, and tremors. Some adverse effects include seizures, suicidal thoughts, or behavior. Contraindications of Wellbutrin include the patient with a hypersensitivity reaction. It should not be given with MAO inhibitors or MAO-like drugs. It should not be given in the patient with seizure disorders. Also, it is important to ask the lactating mother if she is on Wellbutrin, because it has potential serious side effects in nursing infants. So when should you call the doctor? Well, the doctor needs to be called if the patient begins having any thoughts about suicide or dying, attempts to commit suicide, new or worsened depression or anxiety, agitation or restlessness, panic attacks, insomnia, mania. The doctor should be contacted if a rash appears or other troublesome side effects occur. And before taking other medications with Wellbutrin, such as Zyban, the doctor should be notified. If pregnancy is planned or suspected, or if breastfeeding or planning to breastfeed, the doctor should be notified. So what should the nurse do? They're responsible for assessing mental status and mood changes, especially during the first few months. Monitor mood changes, inform healthcare professional if patient demonstrates any of the adverse effects. Inform healthcare professional if patient demonstrates any increase in depression, and if this happens, the drug should be restricted. For the patient with SAD, begin administration in autumn prior to the onset of the depressive symptoms, and continue therapy throughout winter and begin to taper off and discontinue during early spring. Some lab test considerations include monitoring hepatic and renal function tests closely in patients with kidney or liver impairment to prevent the elevated serum and tissue Wellbutrin concentrations. Instruct the patient to take Wellbutrin as directed. Wellbutrin may impair judgment or motor skills. Caution patient to avoid driving and other activities requiring alertness until response to medication is known. Avoid alcohol during therapy. Inform the patient that frequent mouth rinses, good oral hygiene, sugarless gum or candy may minimize dry mouth. If it persists for more than 2 weeks, contact your doctor. Inform the patient that unused shell of extended release tablets may appear in stool and that this is normal. Advise the patient to use sunscreen and protective clothing to prevent photosensitivity reactions. The patient must understand the importance of follow-up exams. Encourage patient participation in psychotherapy. Smoking should be stopped during the second week of therapy to allow for the onset of Wellbutrin and to maximize the chances of quitting. You can expect an increased sense of well-being renewed interest in surroundings, acute episodes of depression, and cessation of smoking with the treatment of Wellbutrin. And here are my sources. Thank you.